Mike here with your Mobile Health Minutes, and I'm joined by 2023's Berkshire County Pediatrician of the Year, Dr. Jones. Thank you for joining me on the Mobile Health Minutes this week.
Thank you, and my friends voted for me.
So this week we're going to talk about ticks, and this topic actually was brought up by you, which I think is really important because those little critters are definitely back out and about this year.
They are, and we've gotten numerous calls about tick bites and ticks on children and parents pulling them off or having trouble pulling them off.
Yeah, definitely. So I think a good place to start is probably to talk about protection, and prevention. If you're out there in the woods, if you're out there hiking, if you're out in the garden, think about wearing those long sleeves or those long pants. I know the weather's nice, and if you feel like you need shorts and a t-shirt, it's always important to make sure you do a good tick check.
Absolutely. My husband was out mowing the lawn today and pulled the tick off of himself. He was on mowed grass and there was still a tick. And they're so small, you really need to check, and they're very good at hiding as well. Definitely. Especially on I bring my kids in right before the bath. I love to do a tick check on them because that's the best time. They're getting ready to take a bath anyway, and so they're fully exposed. I can check out those dark crevices and those little places they like to hide. Yeah, a week or so ago, a parent brought a child in. They had one behind their ear that a teacher found. So they do hide. So you have to check everywhere. Hairlines, behind the ears, private areas. You got to check everywhere.
If we find a tick, we got to remove it, right? We got to get it off. I think one of the best ways, that's recommended is to use tweezers. I find you really don't even have to go digging for it, right? You can just make sure you get as much of it as you can off, and then just cleaning the area with soap and water. I don't know, do you have any specific?
Yeah, so there's actually, the pet stores have little tools that almost look like a crowbar. That you can catch the tick and then spit it, and it comes out pretty easily.
Awesome. So now everyone obviously wants to talk about prophylaxis. Everyone, is calling about do I need a doxy? And I don't know, what's your take on prophylactic medication? I know there's some indications and some guidelines.
Yeah, absolutely. So first of all, the tick has to be a deer tick. So that's the first thing.
Yeah, definitely.
So there's an important part to sort of go back to talking about prevention is the little ticks, the baby ticks, the nymphal ticks they're about the size of a poppy seed.
Wow.
So they're the guys that often transmit Lyme. So that's why you want to do the checks. It's kind of gross, but the tick actually has the bacteria in their salivary glands. So they have to feed for 36 hours to be able to transmit it.
Yeah.
And then, you would really expect that tick to be engorged.
Yeah.
But a lot of times people don't know how long the tick's been on there, and that's why you want to check your kids every day.
Yeah, absolutely.
Yeah,
I agree.
And then, so if you think we're a pretty endemic area here, so if the tick's been on there 36 hours and it's engorged, we would probably treat the child with a dose of doxycycline.
Definitely. So I know that's probably a lot for everyone to remember. I think the really key and the important parts here, prevention, right? Making sure you do tick checks, making sure you wear those long sleeves, making sure you pull that tick off if it's on you. And then obviously if there's ever a concern, they can always reach out to the office and reach out to your provider, right? Yeah.
And one of the things I like to tell parents is that the most of the time in children, I think it's 90% of the time, there's going to be a rash, right?
Okay.
So if you know that there was a bite, you watch that area, you watch for a fever. Often when there is a tick bite, it looks inflamed, but if it's Lyme, it'll get bigger over the course of days or weeks. So you can mark it with a Sharpie and keep track of it that way.
Awesome. That's a really good idea. Definitely going to start telling my patients the same thing. So there you have it. Ticks are out there and they're out in the community, out and about. Lyme is really prevalent in our areas. These are some of the guidelines that we kind of recommend. As always, if you have any questions or concerns, you can reach out to your PCP, reach out to the pediatrician's office. I'm sure they're more than happy and willing to help you wrestle those kids and get those tick bites off, right?
Save your money. Don't test the ticks. It's not going to change our management. Go buy the kids ice cream. Don't test the ticks. You can find something better to do with your money.
Awesome.
And don't worry about getting those last bits out. You don't have to dig them out. Just, keep it clean and keep an eye on it.
Yeah, definitely. And as always, if you don't have a PCP or you can't get into your appointment, you can always come find us on the mobile health unit. You can find our schedule listed below at the website or at the phone number listed above. And as always, I hope to see you out there. Enjoy the summer.